I hope I'm not getting sick. Oh man, 102. I am sick.
We begin with breaking news this evening. For the first time, Ebola has been diagnosed inside the United States.
World Health Organization said on Tuesday the Ebola death toll jumped by almost 200 in a single day to at least 2,296.
It's too late to halt the spread of the Ebola virus.
Ebola is now an epidemic.
Without specific drugs or a vaccine for Ebola, the only thing doctors can do for those suffering from this disease is treat their symptoms.
Oh man, I had to go in sick to work today. There's no way to go in. Oh, I have Ebola. Hey Greg. Hey, what's up? It's Louie. Hey, I'm not gonna be able to come into work today. Yeah, I'm pretty sure I have Ebola. Yeah, Ebola. You haven't heard of it? No? It was on the news. It's an epidemic. Obama said so. It was on the news this morning. I have a temperature. Dude, what if I die? Like, I might not ever be able to come back to work. Yeah, so that means I'm not going to come into work today. I have to go get checked out. What if I have Ebola? It could kill me, Greg. Okay, I'm not coming into work today. Bye. Thank you, ma'am. Hello. How you doing, doctor?
Hi, how you doing? John.
Louie.
Nice to meet you, Louie. How you doing today?
Not good, doc. I think I have Ebola.
What makes you say that?
Well, this morning I woke up feeling really crappy. I had a fever really bad, and then I turned on the news and I see all this stuff about Ebola, and I'm thinking maybe that's what I got.
Okay. And when did you first think you had any of these symptoms?
This morning when I woke up.
Really? Okay. And what are some of those symptoms that you've been experiencing?
I just had, really, really bad weakness, fever, and just not feeling good, man. And
okay.
Saw all the stuff on the news this morning about Ebola, making its way over here, and I think, I might have it.
Okay. So what it sounds like is, you seem kind of scared, but it's okay. I'm going to give you a little examination to ensure that you don't have Ebola or you do have Ebola. But I'm just going to ask you some questions. Is that okay?
That's okay.
Okay. So, Louis, in the last 21 days, have you lived or visited West Africa, such as countries of Liberia, Sierra Leone, Guinea, or any region where they've been diagnosed with having the Ebola outbreak?
No.
No? Okay, good. Have you had a needle stick, whether accidental or drug use, anything like that in the last 21 days?
No.
No. Okay. Have you come in contact with anybody you know who has been diagnosed with Ebola?
I don't think so.
No. Okay. Let's see here. Okay. Have you participated in a funeral of anybody that's been diagnosed with Ebola?
I have not.
No. Okay, good. So you said you're having a fever. What temperature did the nurse earlier get you at?
102.
102. Okay, 102. So you kind of fit that criteria, which is.
Does that mean I have Ebola?
Well, no.
Oh.
But fever can be many things.
Okay.
But in this case, you
Like
do meet
Ebola.
criteria. I'm not saying that, but we'll get there.
Okay.
Because patients that are usually having a fever that's greater than 101.5 degrees Fahrenheit or 38.6 degrees Celsius have been associated with signs of Ebola. But then again, fever overall can be attached to many different types of diseases or could be the common flu. So what we're going to do is I'm going to ask you some more questions.
Okay.
So have you had a headache, joint muscle pain?
I did have a headache a couple days ago.
All right. Any abdominal pain?
Not really.
No? Okay. Any weakness, diarrhea?
I was pretty weak this morning when I woke up.
You were?
I wasn't feeling good.
Okay. Any vomiting?
No vomiting.
How about any, like a lack of appetite?
No, not really.
No? How about a rash or any red? Did you notice your eyes were red this morning?
No, I did not notice
No.
that.
Okay. How about hiccups, cough?
No?
No? Okay. Chest pain? Difficulty breathing?
No.
Okay. Your lungs sounded very, very good, so that's good. Any difficulty swallowing or any bleeding that you've noticed?
Well, I got a cut on my hand the other day.
Okay. What? Tell me about that.
I cut myself.
You cut yourself?
Yeah.
Okay. And so, Louis, that kind of concludes our assessment. To me, you're presenting like you are Ebola-free.
Ebola free?
Ebola-free, yes, sir.
Are you serious, Doc?
Yes, sir.
Thank you so much.
No worries. I'm glad I could be of assistance to you.
Thank you.
Okay.
Thank you, Doc.
You take care, okay?
All right.
See you next time.
Yes!
For those of you who don't know what the Ebola virus is, we're going to go ahead and talk about it. So the Ebola virus, which has been on the news lately, lots of people have been terrified of it and thinking they're going to get Ebola. So let's go over it. So the Ebola virus was formerly known as the Ebola hemorrhagic fever. It is severe, often fatal illness in humans. The virus is transmitted to people from wild animals and spread in the human population through human to human transmission. The average Ebola virus disease case fatality rate is around 50%. Case fatality rates have varied from 25 to 90% in past outbreaks, but they've been 50% in the current outbreak. The first Ebola virus disease outbreak occurred in remote villages in Central Africa, near the tropical rainforest, but the most recent outbreak is in West Africa. It has involved a major urban as well as rural areas. Community engagement is key to successfully controlling these outbreaks. Good outbreak control relies on applying a package of interventions, namely case management, looking at each case and going through with a fine-tooth comb and establishing what caused this Ebola outbreak. Early, as well as there is no licensed treatment yet that we have found to neutralize the virus, but there's a good range of blood, immunological, and drug therapies that are under development currently to help stop this spread of Ebola. And like I said, there's no vaccines that have been established yet, but we're currently working, and we have 2 possible candidates. Let me look in my notes here. So far, the death toll has been approximately 15,351 in this last case, and that's through 8 countries across the world. Initially, the outbreak was 5,459, but it has gradually been increasing throughout these last few months.
Yes!
I'm Dr. John Nozick. You stay Ebola free.